I am Thandi Puoane from the School of Public Health, University of the Western Cape. I'm going to be talking to you about food and health and the impact of COVID-19. Let's look at the facts about food. We all know that food is a basic need for living. Everyone, each and every one of us, need food. Because food gives us energy to be able to do work. So we need to eat daily. There are also certain beliefs and norms that are related to food. For example, people decide what type of food to serve when they celebrate and what type of food to serve when they are in the mourning period, when there is death. So food comes from plant or from animal, and they contain essential nutrients such as carbohydrate, fat, protein, vitamins, and minerals. All these that I've listed are needed to perform essential body function. For example, to repair worn-out tissue, to provide us with enzymes so that we can digest food and so on. So in other words, food is any substance that is consumed by individuals in order to provide nutrients. So we get nutrients from the food that we eat. So when we talk about good nutrition, I'm going to be talking about the balanced diet, which will come later. But good nutrition is very important for health, especially in times when the immune system is low, and it might be needed to help us fight infection or infectious diseases, such as this time of the COVID-19 pandemic. So now let's look at this slide here. The title is How to Maintain Health with Nutrition. For us to be healthy, we need to eat a well-balanced diet. This diet will help us to build a stronger immune system, which will help us to lower chronic and infectious diseases. So eating a balanced diet means eating a variety of fruits and vegetables, as you can see in the slide, and avoiding unprocessed food. This will help us to get vitamins, minerals, and dietary fiber, protein, and antioxidants. All these are needed by the body. Fruits and vegetables have a lot of fiber. And of course, minerals help us, and vitamins help to protect us against diseases. In addition, we need to drink enough water. A lot of water, it helps us to fight infection. It cleans your body for all the unnecessary things that may be poisonous to your body. So we need to drink a lot of water, and also they help us in digestive system to aid the digestion of food. The red circle that you see there with the cross, it means that avoid processed food. So things that you must avoid, as I've mentioned, is processed food such as bolognese, potato chips, and others. These foods are high in fat as well as in salt, and they put you at risk of overweight and obesity, heart disease, stroke, and other type of cancers. These conditions that I've mentioned, they are risk for COVID-19. You might have been seeing the statistics that those people with those conditions are at risk. You may be aware that processed food are cheap and they are easily accessible. If you visit the supermarket, you will find that this type of food, the processed food, they fill a lot of shelf space in the supermarkets. And people buy them, and most of them, they are always on sale, just to attract people so that they can spend money on them. Now, let's look at what we know about people's food choices. This is based on the work that we've been doing in working with the communities. What we know, or what we find out, is that food insecure people have limited choices. Therefore, they cannot afford to consume a variety of food. I mean those who are living in poverty. Fruit and vegetables to them is a luxury. It's not a necessity. When the grocery has been bought, or when they've got a little bit of extra money, they will then think of fruit and veg, especially the fruit. The veg, it's better because some people, they eat it on a daily basis, even if it's one vegetable. Fruits and vegetables are costly. If you visit the supermarket and you compare them with the sweetened beverages, you'll find that the cost of fruit and vegetables is higher. And people, therefore, they opt to buy certain beverages because they will fill you for the time being. So, another point is that fruits and vegetables that are sold at the supermarkets, they lack the variety and they are not as fresh as those that are bought in supermarket, where the people on the upper end, middle class, resides. Those supermarkets that are situated in low resource areas, they are not attractive. Those vegetables, they are not attractive, and people don't buy them as much as the people in other areas. So some poor people also tend to purchase food on weekly or daily basis as they earn money. These people often have temporary work, for example, of pushing the trolleys, of cleaning houses, so they earn on daily or weekly basis, and then they can afford to buy food for that day. Another point is that people who do not have transport, it's very difficult for them to spend money on transport to go and buy food somewhere where there are lots of variety. So they tend to buy their groceries at the local shops and mostly at the street vendors. Those people know them and they often give them food on credit, so that even if they don't have money, they know that they will get food and then they will later pay at the end of the month or at the end of the week when they earn a little bit of money. The last point is that whenever people meet, food is served. So people often go to parties, they go to funerals, and they are sure that they are going to get a plate of food which will serve their needs or nutritious needs for that day. So what are the challenges for lockdown, during lockdown for COVID? Some people lost their jobs and income, which means that they could not afford to buy food as they wanted to. Fruits and vegetables from food vendors were no longer accessible, because there with the fruit vendors, you could buy one tomato, one onion, and you can go and cook. You buy it as you need. So those things were not available. School feeding services were terminated. So children did not have, those children who rely on a nutritious meal from the school no longer had those meals. So they had to eat what others are eating. Those people who purchase food on a weekly basis were left with hunger. They didn't have job, they could not buy food. When lockdown was announced, people who could afford They went to the grocery shops, they bought a lot of food, they filled their trolleys, and they filled their cupboard. But people who do not have money, they didn't have that money to go and buy that food and store it so that they could eat during the lockdown. So then purchasing food at the supermarkets that were opened did not suit everyone because there's no credit at the supermarket. And the lines were long, they were very long due to social distance. So it was very difficult for other people to go and buy food at the supermarket. And the food prices went high, which made it very difficult for people to access healthy food. So what is the impact of this on nutrition and health? Food insecure people suffered hunger, as there was no buying on credit, as I've already said that. There were no community gatherings. They were not allowed to go to funerals if it's not a relative, because only a limited number was allowed. So, which means that some people were deprived from getting free food. So people, in order to satisfy hunger, they relied on starchy food and sugary food. You know, it's cheaper to buy a loaf of bread or fat cakes and sugary drinks and eat to satisfy hunger rather than to think about nutrition. Nutrition becomes, a well-balanced diet becomes impossible when you are hungry. Unhealthy food, we know that it puts people at risk for diabetes. It's obesity, which is a risk factor for diabetes, and other risk factors like high blood pressure and other cancers. And these makes people to be prone to COVID-19. Poor nutrition in children is also not good. So yeah, within the same family, adults will eat a lot of the poor nutrients and children eat a little bit because their tummies are small. So they end up being undernourished, underweight, and they're also prone to diseases. The most important thing to remember is that unhealthy food lower immune system as well as the ability to fight infections, which is really a problem because due to COVID-19 pandemic, a lot of infections that we need to deal with. So how do we move forward? There is a need to revamp community belonging. In the olden days, no one went to bed hungry. Community members were aware of the poor families and they were able to share food accordingly. We need to look at the community gardens. These need to be encouraged to enable community members to work together towards a common goal so that they are not only relying on bought food. We need to promote and strengthen local traders or local vendors and local supermarkets to ensure that they are part of the existing system. Thank you.